morning, morning, morning. Good morning. Good morning to you.
We'll take. And Morning Barbados is back. Yes, I'm having a bit of fun here with my guest from the National Council on Substance Abuse. It's Awareness Month. Yes, Drug Awareness Month for 2024. And what a way to start the new year by making us aware of all that's happening. Illegal drugs are unfortunately a part of the society in which we live, but we have agencies like the NCSA to help guide us through. I want to welcome Ms. Wendy Greenwich, who's a substance abuse prevention officer, and Mr. Troy Wickham, who's the deputy manager over at the NCSA. Now, I'm going to come to you first, Wendy, my namesake here. Now, the theme for this month is NCSA strengthening prevention. How easy is it really to stop people from going down this road? And what are you or can you do to strengthen what you already have in place?
Well, good morning, Wendy. Good morning, Barbados. There's always room to improve. That's the position that we take at NCSA. So it's not easy to stop somebody from going ahead and doing what they choose to do. But in the field of prevention, our intention is to either delay you actually starting, or if you have already started, then to stop it from progressing and becoming something more difficult to resolve further down the line. Okay. So that's the approach we take from the prevention side.
Okay. Now, when we talk about drug abuse, Troy, and misuse, the whole idea is to get our bodies back functioning in a healthy and productive way, because we know it impacts our society as a whole. In terms of where we're at now, what are some of the niggling, troublesome areas that Barbados needs to be conscious about?
Good morning, Wendy. Good morning, Barbados. First, at the NCSA, I must say that we have, over the last few years, we have discovered that the drug situation locally has been slowly diversifying. Persons willing to experiment with drugs that are new to the Barbados market. Only recently this year, in March, we issued an alert coming out of our early warning system, where we found persons using NDMA, better known as ecstasy, as well as methamphetamine. Mm-hmm. And then in August of this year, we recognized persons were using synthetic cannabinoids. And this has been really concerning for us. So as a result...
Just explain to the public what the synthetic cannabinoid would be. For me, it's fake weed. But
yes. Basically, it is persons usually have any vegetable matter, and they spray a chemical that is not for human consumption on this vegetable matter, and it can be devastating. It can cause you your life. You can die as a result of using it.
Was that the one that had people looking as if their bodies had rigomatized?
Yes.
When the guy was out straight, unable to move?
Yes, it was. For sure, I must thank a member of the public for actually bringing the sample to the NCSA. And we took that sample to the Government Forensic Science Center, where the center was able to test this this chemical, this vegetable matter, I must say, and we found it to be MD Pinnacle and MD4 Boutica. And when we Boutica, and when we did our research, we recognized the Boutica caused 4 deaths in the UK, and the Pinnacle actually caused 12 deaths in the USA. So we decided to launch a campaign educating the public about the harms associated with using this synthetic cannabinoid.
Okay. Now, in terms of the synthetics, can they be placed in the vapes as well?
Yes, they can. Again, we are actively in the schools educating the student population the dangers of using vapes as well. Persons actually tend to think that using vape is less harmful than actually using tobacco, and it's not so. So we're actually actively educating the school population the dangers of using vapes as well.
Okay, now we're talking school population. I'll switch back to Wendy, because I know you have a lot of active programs going.
Yes.
You also work alongside a number of the agencies as well. who help with the management of the substance abuse. Now, in terms of that movement, from the prevention point to when they actually do start and you have to get them rehabilitated, what kind of numbers would you say we're looking at right now in terms of our drug problem?
Well, what I can say is, despite what is normally put out there in the media, the majority of our young people are not using. It's often great to glamorize those who are using, and you say, oh, this percentage of people are using. What I can say is the majority are not using.
And that's good news.
It is fantastic news. Of course, there'll be some variations depending on what the substances that they are using. Because, for instance, with our primary school survey, which was last conducted in 2020, we found that the majority of our children had been exposed to alcohol use.
Okay.
But looking at it on a national level, that's not really surprising, because the majority of persons do have alcohol within their homes.
And it's a culture thing.
And it's a cultural
They
thing.
like to tell you, take a little brandy for worms.
Exactly. Even if the baby's not sleeping, give them a little something. It will help them to sleep. And, you know, it's literally part of our culture. From birth to death, you're going to find alcohol. So to hear those figures, when you look at it holistically, it really is not surprising. Okay. But if it was, for example, synthetic cannabinoids, which we spoke of earlier, and we had 50% of the population using, well, that would be staggering. So when we hear about these various substances, we have to look at the entire picture and say, okay, what's happening on the ground culturally? Is this becoming a cultural norm? Is it acceptable amongst the population? Because it basically is acceptable for our young people to be using alcohol. Let's face it, it's basically accepted.
I think one of the other things that you're going to be working on during your month is that of the stigma of the substance abuse. We use a terminology here, which isn't necessarily the best, but it's how people refer to drug users. Some people might elicit laughter from some, but it's really not funny, you know, and people tend to become very abusive of them on the street. But it's difficult to kick a man when he's down and can't help himself, Troy.
Yeah, yes, it is. I can say recently we have conducted a research project, Barriers to Treatment for Women in Barbados, and we discovered the survey actually discovered that one of the main reasons women don't actually present themselves for treatment because of stigma. It's very concerning because, as you said, we see substance use and substance abuse as a criminal justice issue, but really as a public health. And it's important that family, friends, the community embrace persons who have been negatively impacted by substance use and abuse and encourage them to seek treatment so they become productive citizens once again in the community. Again, the children is one of the reasons that prevent women from actually entering treatment as well. So it's important for us to educate persons and let them know, well, look, we are here to help, especially NCSA being the authority in Barbados for drug demand reduction, and as well as the treatment facilities. We extend a helping hand to you to come present yourself so you become productive citizens once again in the community.
Okay. Now, I'm glad you mentioned the women, and I guess it would concern Wendy as well as a prevention officer. Unfortunately, a number of people who are on drugs tend to find themselves victims of crimes because when they either want more of the substance, there are people who may force sexual advances on them, or they might find themselves in positions where they feel forced to do that, to engage in prostitution in order to get this fix. In terms of our young people, how worrying, or have you seen signs that people are willing to be transactionary in order to get these substances?
Well, if you look at the local as well as the international research, you will find exactly what you have said, that for females in particular, they tend to use more depending on what their partner is doing. And they tend then to escalate more based on what their partner is encouraging them to do. So yes, we're going to find that situation pertaining here as well as is happening overseas. And it's something that we really want to tackle head on. And as we progress throughout the year, I believe we will be implementing programs specifically for females, which will start to target those particular issues.
Okay, I want Troy to tell us about some of the things that are going to be happening during the actual month.
Okay, I can say for sure we'll be actually conducting training with the Barbados Police Service to show them how they can assist us with the early warning system, the benefits of our early warning system. We also be partnering with the A&E department, again, focusing on the early warning system. We'll be having a community drive-through through the St. Michael communities, Christchurch communities, to let persons know we are here, the services we are offering as the NCSA. We also be having a fun day for our stakeholders where you can come out and have some fun, partner with us, have some wholesome fun with the NCSA. And we're having some online webinars which will focus on treatment and rehabilitation and the benefits of it.
Okay, now we're talking about treatment and rehabilitation. I believe you had a report done looking at a former drug abuser who went to Verdun. I think you would have,
Yes.
published that. Enlighten us a bit more about that.
For me personally, it was very emotional. The journey, her story was very emotional for me personally when she was able to let us know how low she was at one stage of her life and how actually entering a treatment in a facility, a residential treatment program, was able to help her on her road to recovery. As you may not know, but addiction is a disease, a lifelong disease. Sometimes you can fall off the wagon.
You
And
relapse,
You
yeah.
relapse. So it's important that your family and the community assist you along the way, hold your hand along the way. And I'm happy to say that she's on the road to recovery. She's doing well, and her story should be inspiration for
So
the
others.
entire nation.
Now, Wendy, in terms of that support, how easy or difficult is it usually when family members have given up on the individual? Because it happens.
It
because
does happen.
I know people who've gone to Verdun House 3 times.
Yeah.
I mean, it can be frustrating. Everybody doesn't have the same willpower.
Yes.
But how does NCSA try to play that mediatory role?
Well, one of the services we do offer at NCSA is a counseling service. And up front and center, we encourage the family to be part of the treatment program for the individual. Because there's no point in me just saying, well, that's his problem, it's nothing to do with me. As you know, everything that happens with a family affects everybody. So it's important that everybody is in with the treatment program and understands that relapse will happen, and that if you need additional support, it is there for you, because it can get very frustrating.
But
Because
not
you're
just
trained.
frustrating, But when you have a situation whereby you have taken this family member to 2 institutions already
Yes.
to get some help, and then that said family member turns around and robs your house,
Yes.
your sister's house, your brother's house, your uncle's house
Yeah.
to feed this habit, it's very difficult for people to find that level of care and concern to the point whereby they will ignore.
But sometimes part of the care and concern also means that you have to care and be concerned about yourself. And it sometimes does get to the point where you say, okay, I have done what I can do, and I now need to step back and just take that release. Because you may then find yourself in a position where you are unable to cope with your day-to-day activities because of the stress of your family member.
Well,
So for
I remember
self-preservation.
I remember an instance where the person almost burnt the house down,
Yes.
Yep.
Yeah.
Possible.
trying to use,
Yes.
stuff out of the home to deal with
Yeah.
their pipe.
Sometimes you just have to say, I love you enough to let you go.
Okay, so we can get to that
You
point.
can get to that point.
Okay.
Because you have to remember that you as an individual still have responsibilities for yourself, for other family members, and the best thing to do is love them enough to let them go.
Now, Troy, we recently saw coming out of Australia a ban on vape. Do you think this is something the NCSA would push for? I know you've pushed for blocks on other things, like with the tobacco being sold underage, ensuring that the alcohol is not served at fetes. Children are going to be attending, things like that. What's going to be the push this year? Do you think you all will be on that vape train?
Let me say that vape is tobacco, and it falls under the Tobacco Act that it must not be used in public places. So that push has already been in place. However, it's to educate the public, and that's one of the reasons for, especially for the next 3 months, we'll be engaging the Barbados Police Service to speak to the acts, the various acts surrounding alcohol, surrounding tobacco, surrounding the amendments to the Cannabis Act, to let them know whether these laws needs to be enforced.
Okay, so that means that we are not going to be seeing anybody, the guys on the block anymore with long necks exposed. You want to ensure that alcohol is covered and not shown. You want to be sure that anybody going to purchase a vape or cigarettes has to show an ID. Those are the areas you're pushing for.
Yes, we are. Yes, we are. It's important that we protect, especially the younger demographic, against obviously the appetite for substances. As you know, as Wendy said earlier in the conversation, that alcohol is all over the home, and our research has consistently shown us that for accessibility, the home, a family, siblings, and they introduce the younger demographic to substances and give them the appetite for substances. And we are trying to obviously
Or they
deter
might
them.
not even give them the appetite. An uncle or aunt may be decent or polite enough to go outside and smoke, but the little one might be looking through the window, see it, and say, "Oh, auntie or uncle seems to be smiling when they're doing this. Maybe I should try it too."
Let's be real. If I have a sibling or parent who engages in substance use and they go to work every day, they appear to be functioning normally, and then for Wendy or myself to come to your school and say, well, look, drugs can kill. Then I would say, but for 40 years, I saw my daddy smoking or drinking rum or using alcohol or using marijuana. He got no very normal to me. So that's the challenge.
But you know, a lot of centenarians will tell you a shot a day kept them going.
It's more the way eating and drinking, though.
That's true. That's very true. Now, I want to thank you all for coming. I wish you the best during your month of activities.
Thank you.
And let's hope that you continue to spread the education message and that people heed the message and heal us from substance abuse.
Thank you so much for having us.
Morning, morning, morning.